Hello everybody, a warm welcome from the mebix team. My name is Ulrike Laube. I'm responsible for strategy and commercial at mebix. And I want to talk today about mebix, how it's actually transforming chronic disease management on the example of type 2 diabetes, how it's actually establishing healthy lifestyles and then leading to bigger health outcomes. At mebix, we exist to empower patients and healthcare providers to combat chronic diseases through clinically proven, easy implement solutions from small manageable steps for patients to high health impacts. So why are we doing this? In Germany alone, every minute, someone is diagnosed with type 2 diabetes, in addition to the existing 8.7 million patients we have already. And the prevalences are projected to grow even further. In 2040, we are expecting 12 million type 2 diabetes patients. And we also have seen the incidence regain growth during the COVID season of plus 10% CAGR every year to 500,000. That's really huge, right? But this is not the problem. The real problem is that in Germany and probably also in other European countries, we are spending 36 billion euros on treating symptoms while leaving root causes like healthy lifestyle and insulin resistance untouched. The 36 billion euros per year are actually medication costs, medical device costs, complication costs like amputation, blindness, or stroke due to type 2 diabetes, or indirect costs from productivity losses. We know that type 2 diabetes and other chronic diseases can be progressive diseases. That means when I'm starting and when I'm diagnosed with type 2 diabetes, I'm getting on the metformin track. And if I don't do anything about a healthier lifestyle, I'm actually ending up after 10, 12 years on average on insulin. And we all know that with insulin, we are gaining weight, and it's actually the vicious cycle of worsening of the disease even starts further, and we get more complications. Here comes mebix in. Oops. Sorry. Here. Here's a comparison from the different medications, how we can treat type 2 diabetes. And what we see actually is that most of them are nice in lowering the HbA1c, the long-term blood sugar level. But this is a symptom. They're not actually focusing on the root causes. Some of them also doing the weight loss quite nicely, like metformin, GLP-1 or SGLT2 inhibitors, also the cardiovascular disease risk. But none of them is actually having a sustainable effect after therapy stop. So massively costs into the healthcare system without any sustainability effect. So we're actually needing a change, something new, where we treat the root causes with lifestyle and behavior changes. So now here's a place where mebix comes in. Mebix is actually addressing the gap in type 2 diabetes treatment. It's a comprehensive treatment for all type 2 diabetes indications, including comorbidities like obesity or cardiovascular disease. It's a multimodal therapy, nutrition, exercise, behavior, and stress management, high proven clinical and sustainable efficacy, and it's 100% reimbursable under the DiGA law in Germany, and no additional devices are required. So how's actually mebix doing it? mebix takes patients on a journey of small manageable steps. And these manageable steps actually lead into big health outcome. So how we are doing this? These are the really simple follow-through a patient has to do. So each patient who's going on that journey has simple posted like activities, as you see it on the fridge. There are activities like video education or shopping, or in a good way in terms of healthy diet, documentation of certain bioparameters, and this is only 5 minutes a day in addition to exercise. But the real uniqueness is how mebix is building a conscious for healthy lifestyle. And how we're actually doing this. You see here, these are the two protagonists. It's a male and female protagonist, and they have also type 2 diabetes. And they're taking the patient on their journey because they also want to lose weight and get away from the high blood sugar levels. So actually, the patient is getting the same journey as the two protagonists, and it's a high identification. This is psychologically proven that this is helping to build a high, efficient, and sustainable effect. The other simple steps we are helping, you're taking as a patient your smartphone, taking a photo of your food, and the AI is helping you to get a good ingredients analysis in terms of here, for instance, it's egg, avocado, olive oil, and salad, and then it's translated into carbs, fats, and all the other ingredients you need. Based on this, we also have coaches in our program, because as we all know, even in a digital therapy, you need the human in the loop, and sometimes if there are hurdles or if you're stuck, it's good to talk to a human, not only to a chatbot or to a digital application. So the nutritional and exercises coach is helping here to build individual plans. So based on this, in the small, simple steps, we get to high sustainable health outcomes. We have several studies. We just highlight here two, which are very important. One is an RCT study with a German pension insurance with coronary heart diseases patients. And here the study design is like this to test the sustainability. We have 12 months of measuring the patient's outcome, but only 3 months in the beginning is the intervention. So after 3 months intervention in the beginning, after 6 and 12 months down the road, the parameters are measured, and we get a high significant reduction of the body weight by average -8 kilograms from the entire cohort and -14 kilograms from the type 2 diabetes subgroup. We have further reduction in cholesterol levels and a high increase in quality of life. For type 2 diabetes, important is how the HbA1c, the long-term blood sugar level, is decreased. And this is done by observational study by Professor Schwarz in Dresden. And here we have achieved -1% in 3 months, which is really good. So in a nutshell, that's a very efficient and sustainable therapy. We see this also from feedbacks from our patients. So one said, my belly is gone after such a short time, or I really like the coaching team that helped me a lot. But you also see that from our ACPs. So Professor Schwarz highlights the playful guidance towards sustainable lifestyle changes, and Dr. Hans-Jörg Mühlen likes the more efficient and targeted treatment. So in a nutshell, mebix has the strongest offer compared to all the other 3 DIGAs who are on the German market. In terms of coverage, it's the broadest, the strongest product offer, the highest clinical efficacy and the highest sustainability. And we also have clinical software for clinics and big practices. So addressing the pain points across the ecosystem, it's not only the patient who gets higher quality of life, it also avoids complication. For the healthcare provider, it's time efficient, and for the health insurance, it reduces costs and long-term savings. It's a big market. We're going also into other diseases. We actually have built a multi-disease platform with different reimbursement models, not to be dependent on DIGA framework only. And we have built type 2 diabetes, coronary heart diseases, and we are now in the progress to build obesity and non-alcoholic fat liver disease, which comes very often with the other primary indications. So for healthcare providers, we look for partners who want to leverage mebix for their patient success. If investors are in the room, we also see later a few. We want to scale our vision across Europe. At the moment, it's in Germany, but we're also looking into other DIGA countries or countries who, like the Nordics or even Spain, who have high chronic disease prevalences. And for strategic partners, we like to develop hybrid care models together. So visit us at booth 110. Thank you very much for your attention. I know it's lunchtime. Have a good one. Thank you.